My name is Amber Chelly, and I'm basing my Intro to Health Professions presentation on occupational therapy. What is occupational therapy? Well, occupational therapists, they're able to help patients with day-to-day tasks and improvement in living and working settings. So they do work with a range of activities, from knowing how to use a computer to the daily tasks like using the restroom, knowing how to eat, knowing how to drink, using a hairbrush. They even have assistance with aids, like eating aids. They even work with hearing aids and wheelchairs for walking, because essentially these patients could have some permanent disability conditions. So they work with all types of daily functions. Scope of practice. So occupational therapists, they work with a domain like, all occupations. And I picked out a few that are important. Daily living activities. So this could be just like self-care activities. It's just working with yourself. And this is based off of, how the patients can view occupational therapists and, the occupation that they work with. Social participation. So this is just, working in a social environment with other people, willing to work with them, willing to interact with them efficiently. Employment and volunteer work. So occupational therapists, they can help patients independently with knowing how to just work in a setting. Volunteer work, so they're able to work with other people in a public area. And education. This is just the patient's able to learn what's being given to them, what they're working with, and they're able to efficiently strive in the learning environment. Working conditions. Occupational therapists, they're consistently interacting with their patients individually to perform the highest quality treatment and any other services. So occupational therapists, they do work alone, but many do work with other healthcare professionals such as doctors, other specialists, nurses. They even have occupational therapist assistants, or aides is what they also call them. So they do work with different people because they can receive different, they can provide different services, help them with the patient to have, the best outcome as possible. Earnings. So the median annual wage for occupational therapists was around $83,200 in 2017. I believe the top 10%, once they're there for a long time with, location as well, it's up to making more than $120,000, and the lowest 10%, it can be depending on location as well, experience, and even starting up in occupational therapy ranges, it could be less than $54,000. And yeah, the entry-level median pay is around $34.15 hourly. Requirements. For occupational therapy, the education, a lot of, especially graduate schools, they require just basic prerequisite courses such as biology, chemistry, social science, sociology, and anatomy. There's a whole bunch more, but these were the most basic ones. There are a few majors that you can take while you're, in your undergraduate years, such as health science, social science, and biological science. They are good majors that work with, pursuing a career in occupational therapy. And in order to become an occupational therapist, you must have a bachelor's degree of science, so you have to have the 4 years, and you have to have a master's degree in occupational therapy and essentially higher, because a lot of jobs do look at and would like individuals with a doctorate degree in occupational therapy. Other than the degrees and stuff, you also have to take a national and state exams administered by the National Board for Certification in Occupational Therapy. And also to advance, other than, the exams and the degrees, you can take workshops and education courses and internships as early as possible, and that can honestly, influence higher, recommendation into future careers. This is my timeline for occupational therapy. I'm not completely sure what I was wanting to do yet, for the future, but I do have an idea I have been looking at different internships for OT, especially because it's my junior year now. So I was thinking of doing that and possibly another one, since internships that I've seen were around 12 weeks long. I have on the bottom just the length of where I'm at. So I'm estimating graduating in 2020 for USF, and then I was going to go into graduate school. And then around my second year, I was wanting to study and then essentially take the MBCOT exam for my OT license. But I'm not completely sure on how long you have to be into graduate school to take that, or how long graduate school is. And these are my references. Thank you.